Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurophysician from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very interesting topic, Paraplegia, a clinical approach. Concepts of motor system, part 11. Paraplegia, a clinical approach. Etiology of paraparesis. First, let's talk about the acute paraparesis. So, paraparesis developing suddenly. Acute paraparesis is usually due to spinal cord disorders. It is most commonly caused by an intraspinal lesion. There is a sensory loss in the legs with an upper level on the trunk. A dissociated sensory loss is suggestive of a central cord syndrome because the spinothalamic tract fibers crosses and then ascends. So a central cord lesion will affect the crossing spinothalamic tract fibers. So there will be loss of pain and temperature but presence of touch position joint vibration sense. Or there could be hyperreflexia in the legs with the normal reflexes in the arms. When we do imaging, the imaging of the spinal cord may reveal a compressive lesion, infarction. Proprioception usually is spared because the infarction is usually due to anterior spinal artery, whereas the proprioception, that is the posterior column fibers, are usually spared because they are supplied by the posterior spinal artery. So infarction, proprioception is usually spared. It is because of anterior spinal artery. Arteriovenous fistulas or other vascular anomalies or transverse myelitis. Continuing with the acute paraparesis, paraparesis may also result from a cauda equina syndrome after trauma to the lower back or a midline disc herniation affecting both sides or an intraspinal tumor. Rarely, paraparesis is caused by a rapidly evolving anterior horn cell disease such as poliovirus or a West Nile virus infection. Sometimes acute paraparesis may be due to cortical disorders also. So the diseases of the cerebral hemispheres that produce acute paraparesis include anterior cerebral artery ischemia, because the anterior cerebral artery supplies the leg area, and therefore when the bilateral anterior cerebral arteries are affected, both the leg areas get affected. Patients present with paraparesis. Or there could be a superior sagittal sinus or a cortical vein thrombus or an acute hydrocephalus. Acute paraparesis could be due to a peripheral nerve disease like Guillain-Barré syndrome, a rapidly ascending type of peripheral neuropathy. Acute paraparesis also can be due to muscle disease, like it could be due to inflammatory myopathy. So due to muscle, it may be due to myopathy, example, inflammatory myopathy. Now let's talk about the subacute or chronic paraparesis. If hemispheric signs are present, a parasagittal meningioma or chronic hydrocephalus is likely. When associated with lower limb sensory loss and sphincter involvement, a chronic spinal cord disorder should be considered. The absence of spasticity in a long-standing paraparesis suggests a lower motor neuron or a myopathic etiology, because spasticity indicates upper motor neuron lesion. So when there is absence of spasticity, it has to be a lower motor neuron lesion. So the absence of spasticity in a long-standing paraparesis suggests a lower motor neuron or a myopathic etiology. These are all the important concepts of paraplegia. The other important concepts of clinical neurology like history taking, general examination, neurologic examination, hemiplegia and paraplegia, especially for the clinical neurology exams. I put all important points in a book, Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas. If interested, this book could be purchased. The other important concepts of neurology, I put it in a question answer format in a book, Focused Neurology, written by me, Dr. Sreenivas. This book is available online from all leading booksellers, including Amazon. If interested, this book could be purchased. So these are all the important, fascinating concepts of paraplegia. and the clinical approach to paraplegia. I hope you have enjoyed listening to it. If you have really enjoyed it, please like it, share the link, but please subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.